focus on what matters.
Welcome to our Vitals Checkup event on innovations in senior healthcare. I'm Tina Reed, healthcare editor at Axios, and I'm coming to you from Washington, D.C. Welcome to our audiences on Facebook, YouTube, Twitter, LinkedIn, and on Axios.com. Join the conversation today on Twitter with @Axios and #Axios Events. Over the next 30 minutes, we'll take a look at how technological advancements are transforming the way seniors access healthcare. Our first guest is the senator from Nevada and the co-chair of the Senate Comprehensive Care Caucus, Senator Jacky Rosen, joining us from Washington, D.C. Welcome, Senator.
Nice to be here today with you, Tina. Thank you for having me.
Now, Senator, I wanted to start with talking a bit about your personal experiences when it comes to the issue of caregiving and how it's inspired your work in this area. Can you talk about that?
I would love to talk about it because for many people who know my story, I took care of my parents and in-laws as they aged. I actually stepped away from my career. It was so great to have them live nearby when they were younger, but as they got older and ill, I had to take time off my job so I could take care of them. And so we went through cancer and heart attack and broken neck and Alzheimer's, the things so many families go through. And so born out of that experience, when I got to the Senate in 2019, one of the first things I did was found the Bipartisan Comprehensive Care Caucus. Of course, with Senator Barrasso, he's a physician, Senator Fisher on the Republican side, Senator Baldwin on the Democratic side, because we know that these issues are so important to every single family, how they take care. In this case, we'll talk about seniors, but really the ones that they love when, unfortunately, disease hits their family.
And what in particular did you learn about the resources that are or are not available in the U.S.?
Well, of course, my parents and in-laws have been gone a while now, almost a decade or so. And so when I started, we'll take my mother, for example, she had terminal lung cancer at the end of her life, but it metastasized to the rest of her body. And so she needed palliative radiation in order to have that quality of life. It wasn't going to be curative, but for the remainder of her life. We can take my mother-in-law, who was on the Alzheimer's spectrum. She was just getting older and aging. She needed comfort care for quality of life. So when we talk about palliative care for families, it's not just the patient who might be living with chronic disease like Parkinson's or MS. They might be just aging, and they might be living with terminal illness. It doesn't only affect the patient, it affects their family, the caregivers. And so we want to be sure that family structure and the people who help us take care of our families in these difficult times, all of that is there.
So can you talk a bit about the Expanding Palliative Care Act and what that would do?
Well, I can tell you that I actually have many bills to expand palliative care. One of them is expanding the Palliative Care Act. That's going to allow for that palliative, comprehensive care for the patient alongside the curative care. I have another bill out there to allow for transfusions for people living with chronic diseases. Like I said, it might be Parkinson's or some others, that they can have access to transfusions along the way that may not be curative, but may help with quality of life. Of course, we have to be sure when we talk about seniors that they have access. If they're in rural or underserved communities, we need to get providers out there, and we need to give them telehealth and even telephone. And that's really important. And we need to expand the providers that are there. So if you're getting training through the National Health Service Corps, we've added some options for you to add on palliative care training so you can better serve all the folks that you're going to care for when you graduate.
And speaking of that telehealth care, one of our questions from the audience is, can you talk about some of the adaptations that are being made for people who don't have access to broadband and who may have limited capacity or dexterity?
Yeah, I can tell you that my father-in-law, who was an engineer, built bridges his whole life. He had most beautiful handwriting, but as he got older, he could no longer use a computer or use the iPad because his hand shook. Really important to address these issues. And so if we allow telephone as well as maybe a computer or an iPad, if you will. People can talk on the phone. The other thing we can do by expanding actual access, by having medical providers come out, is that we might have a medical assistant, nurse, physician's assistant come to someone's home, maybe in the case of a homebound senior, set up that device, and then bring the specialist right into the home. And that is also extremely important. So you're in rural area, frontier areas like I have in Nevada, or underserved areas, we're trying to bring all of that to you, because the most important thing we can do is be sure that everyone has access to the care they need.
And when you think about access to care in seniors, what do you think some of the biggest lessons learned during the pandemic were?
Well, I think not just for seniors, but for everyone, we realized that how important it is for follow-up care to have that access, like we're talking about telehealth, the amount of telehealth, what it's done for people, particularly in a lot of the follow-up visits. You might go for a first visit, something important, and then those follow-up visits, whether it's by computer, like we're doing now on a Zoom or something else, or on your telephone, really important having that access. And we know that it's kept people alive. It's helped people who are homebound. It's helped people who can't go with COVID. They're at risk because they have other diseases, high risk. They haven't been able to go into an office. So it's just potentiated everything we do. And it is my hope that we continue to keep it and expand on it, because there's so much more we can be doing with technology to provide good quality health care.
So, what else is the Senate Comprehensive Care Caucus working on to innovate in the space of senior healthcare?
Well, I can tell you that, I'm on the aging committee as well. So we have that better care, better jobs. We want to be sure that we're training people to work with seniors, the particular challenges that they may have with dexterity, with their vision, with their hearing, being able to take care of themselves, because I want people to be able to age in place better. We know we're living longer, and we want to be able to do that on our own terms and in the best way possible. So we're going to be looking at all kinds of advances in technology. And I know for one case, if you maybe if you have Parkinson's or have something where you shake, they're actually inventing the kinds of utensils, spoons, forks, and knives that you can use, and it stops your hand from shaking. And so there are lots of investments that we can do to help people have a better quality of life. Those are the kinds of things we're going to invest in: provider training, expanding access, and just making people more aware that it's not just the patient, it's their whole family who goes through this process, whether it's disease or aging together.
Now, it seems like the big topic recently has been Medicare Advantage. And I know that there's still a lot of seniors that still have many questions about Medicare Advantage. I'd love to hear you talk a little bit about what you think the strengths and the weaknesses are of Medicare Advantage programs and some of the innovations that they can bring to the insurance space.
I think Medicare Advantage can use that economy of scale because they do service so many folks. So they can provide these great comprehensive programs, whether they're in person or online. And people know that they can go to one place to get the information that they need. So when they see that primary care doctor, then they need to see a specialist, or they need a specific exercise program or other kinds of care or treatment. That community setting that Medicare Advantage is going to give you, that's really important. And then you can take advantage of all the other programs. And I think that's the real benefit for a lot of folks, that they go and they have that continuity of care, one common entry point, and all the services will be there for them.
We have another question from the audience. As more than 1.2 million people age with HIV, how do you see senior aging policies coinciding with HIV policy?
Well, that's a great question. I think that, of course, HIV, when it first showed up as a disease, we know that people were not living with it. We know how many people died from HIV, and now through the research, through technology, we've been able to be sure that HIV is no longer a death sentence. And in some cases, I'm seeing some of the research that HIV going into remission, maybe there'll even be a vaccine. that people will be willing to take and be really important. So I think that we just have to, as we see different groups aging and going forward, this is a disease that hadn't been there before. We'll have to address any issues, any chronic disease issues that may have come from HIV and deal with that, just like we do anything else. People are living better longer with so many chronic diseases that used to be death sentences. And so that's the whole goal of this caucus. And that's the real goal of palliative care in general, is that as we live better longer because of medicine and technology and breakthroughs, how do we make sure that we can do that on the terms that we want to in our own homes with our families? And how do we do that in the best way? So we're going to find every way we can to promote that and move that forward, because we're all aging every single day. And so everybody has a little bit of stake in this game for sure.
Well, thank you very much, Senator Rosen, for joining Axios today.
I really appreciate you having me, and I look forward to coming back and talking a little bit more about some of the things we're going to continue to do and some of the new technologies on the forefront. Thank you.
And next, we have a View from the Top segment with my colleague, Senior Vice President of Events and Creative Strategy at Axios, Kristen Burkhalter.
Thanks, Tina. I'd like to welcome Mary Beth Donahue, the President and CEO of the Better Medicare Alliance, our sponsor of this event. Welcome, Mary Beth, to Axios.
Thank you, Kristen. Thanks for the opportunity.
Let's jump right in. Can you tell me exactly what is the Better Medicare Alliance?
The Better Medicare Alliance is a not-for-profit research and advocacy organization for Medicare Advantage. And Medicare Advantage is a public-private partnership in Medicare where more than 27 million seniors and Americans with disabilities receive healthcare coverage. We're also an organization that represents 160 allies who are our partners. And those allies represent the diversity of the Medicare Advantage community. They represent aging organizations, community-based organizations, providers, health plans, all various companies and organizations who serve seniors who are Medicare Advantage beneficiaries. We're also an organization that engages with over 600,000 beneficiaries who advocate for themselves and for seniors on Medicare Advantage.
And today we're talking about innovations in healthcare for seniors, from telehealth to in-home care. What role does Medicare Advantage have to play here?
Kristen, thank you for that question. Medicare Advantage is driving innovation in healthcare, every day. And one of the arenas where Medicare Advantage has led in innovation is in benefit design and offerings. Medicare Advantage provides these additional benefits that are not found in fee-for-service Medicare. Over half of Medicare Advantage plans provide some form of meal benefit. About 4 in 10 provide transportation between medical appointments. And Medicare Advantage has been innovative in its ability to meet beneficiaries where they are by providing care in their home. And the shift in care was so important during the pandemic, and Medicare Advantage plans have continued this beyond that time. Plans like Landmark Health, Signify Health, and United Health through its House Call program have embraced in-home care. They provide additional insight into meeting unmet needs, like addressing tripping hazards in the home, to medication adherence or social isolation, all areas that can't be met by, and are not apparent in the doctor's office. And with this common understanding of medical and social needs, not just medical, but social, it really has Medicare Advantage being able to ensure that beneficiaries are getting the support they need for their healthy lives. And I do want to just add one other area of innovation that is not lost here, and that's in the area of quality. And it's so important. And yes, low premium and copays are so important, and Medicare Advantage has that. but it's important to also not lose the quality of care in this innovative area. And I do want to mention that the federal government measures quality in Medicare Advantage through what it calls the star ratings. And the latest numbers that recent from the Biden administration show 90% of Medicare Advantage beneficiaries are enrolled in 4 or 5-star plans, and that's on a 5-star scale.
And you mentioned 2 important words, innovation and also cost. So to me, innovations equals hefty price tags. And I also just read that the Better Medicare Alliance just commissioned new research on Medicare Advantage costs and payments. So can you break that down for me?
Sure, Kristen, and thanks for asking about costs, because we don't want to have a conversation on innovation without also addressing the issue of cost. Medicare Advantage beneficiaries have a lower cost sharing than fee-for-service Medicare beneficiaries. And I will speak to the report that you asked about, thank you, but I do want to mention that we also have survey data that shows Medicare Advantage beneficiaries report an annual cost savings of $1,640 compared to fee-for-service. And that results in 40% lower rate of cost burden. And that 1,640 means a lot to those beneficiaries. Regarding the report, Better Medicare Alliance, I mentioned, we're also a research organization. And so when we're looking at costs, we want to look at it very closely. So just recently, we commissioned new independent research from the actuarial team at Milliman that we just released. And it showed that not only does Medicare Advantage provide about $32.5 billion in added value to seniors and beyond fee-for-service Medicare, but it also has slightly lower per beneficiary spending for beneficiaries of similar health status. So what this means is Medicare Advantage is not just providing value to beneficiaries, it's also providing it to the healthcare system.
And as we wrap up, what does the future look like for Medicare Advantage? Where do you see it in 5 years, 10 years?
Thank you, Kristen. And I appreciate being able to focus on that outlook, because there's one area that we haven't been able to discuss in our conversation, and that is the increasing racial and socioeconomic diversity in Medicare Advantage. Half of Latinx and Black Medicare beneficiaries choose Medicare Advantage. Over half of the total MA population has below 200% of the federal poverty level. And we expect those trends to continue, and Medicare Advantage wants to be able to serve a higher proportion of the dual eligibles and the socially at risk and the growing minority populations. And as we want to continue to serve those higher proportions, we're also going to need to be relying on policymakers to continue to strengthen and protect Medicare Advantage. And as we look to those 5 and 10 years, I'm very optimistic that we'll be able to continue that support. We've been able to achieve bipartisan support on behalf of the work of our allies and seniors. Congresswoman Val Demings of Florida led a bipartisan letter in the House, and just recently we had a bipartisan letter led in the Senate by Senators Sinema and Scott. And so I have faith that we'll be able to continue those efforts. And it's because of the seniors in those states and districts who are reaching out, talking to members of Congress about how important their coverage is. And so as we look to the 5-10 years, we want to be able to ensure coverage for those seniors and in those various populations.
Thank you, Mary Beth, for your time today. I really appreciate your insights.
Thanks so much, Kristen. Again, thanks for the opportunity.
And now back to my colleague, Tina.
Thanks, Kristen. Our final guest is a Harvard Medical School professor and board chair of the American Telemedicine Association, Dr. Joseph Kvedar, joining us from Boston, Massachusetts. Welcome, Dr. Kvedar.
Delighted to be with you.
So we're here to talk a little bit about innovation when it comes to seniors. And I wanted to kick it off by just talking a little bit about what are some of the more interesting things you've been seeing right now when it comes to innovation targeting seniors and their health.
Well, of course, things changed dramatically in the last 16 months or 18 months because of all of the telehealth adoption that we saw, which is really exciting. And along with that comes some interesting innovations to help make that use of technology for healthcare delivery more available. For instance, you can have a video call with your doctor, but he or she may not have some of the information needed to make a clinical decision. So there are three things that are coming into focus in that regard. One of them is home testing. Very exciting, right on the cusp now of seeing wide adoption. Of course, we've seen the home COVID test. So once again, people getting used to doing things in their home, testing wise. But you'll see all kinds of different labs that you can do in the privacy of your home, either test there or send them off and get results back over an app or a website. So that's one. A second one is home devices. One in particular that's exciting to me, and I don't have any particular financial interest, is TytoCare. That's the name of the company. And the device is about the size of a hockey puck, but it has little attachments, and you can look in your mouth, look in your ears, take your heart rate, a variety of other things, respiratory rate. And so it's like almost like doing a physical exam without having the doctor do the exam. So very powerful way to, again, augment that video visit with your doctor. And the third one is maybe the most interesting, but it's a tool called digital biomarkers. And these are tools, often they're collecting information from your smartphone and analyzing it. One that I am involved with as an advisor is a company called Resap Health out of Australia. It's for instance, their technology can diagnose your respiratory illness based on the sound of your cough. So those are three examples. I think for seniors, we always want to think about things where we can connect them to the external world without them leaving their home, such as the kinds of things that the Amazon Echo Show is now doing. And the whole category of social robots is interesting. One that I like very much is called LEQ, and they're making great advances. So those are a few examples.
Now, I feel like we've seen a lot of gadgets coming out. We obviously talk a lot about like apps on our phones. How do you kind of separate what's just wellness or for fun or even junk and the stuff that really is valuable? And is a lot of this stuff on our cell phones actually becoming pretty valuable when we talk about health?
Sure, that's a multifaceted question. Let's try to pick it apart. So on the one hand, there is junk for sure. The way I typically separate junk is really in two ways. One is it usable? Are people interested in using it? Are people downloading it? And is it sticky? Are they engaging with it? And that's maybe sounds fundamental, but so much of what's out there is designed by people who don't understand what brings us as consumers to engage with mobile technology. And believe me, it's well known from the advertising and the retail industry. So we just have to take lessons from them. The other barometer is, are there good, solid clinical outcomes, usually from clinical research or clinical trials, but sometimes from real world evidence that point us to an outcome that is we can hang our hat on as valuable. So that helps me separate junk from non-junk. And then you mentioned wellness. There's a lot going on in the wellness industry. Again, a lot of it is based on, I think, two camps of people. One are people who are really motivated to stay well. And so because they're motivated, they're going to download things, wear a wearable like a Fitbit or an Apple Watch, engage with it, watch the dashboards. That's a relatively easy population, and it's good to help them, but honestly, they help themselves as much. And then there's a second group of people who are, if we don't help them stay well, they will develop disease, usually from lifestyle choices and things like sedentary behaviors, or perhaps they're overweight or pre-diabetic or what have you. And they're harder to engage. but they're important and they would fit in the wellness category as well. And then, of course, there are people who have an illness and we're developing tools. Those are sort of, I guess the word would be hardcore medical devices. And often there's a nurse call center involved with those kinds of interventions, and they're for people who are sick.
And then when we think about specifically targeting seniors with these innovations, how do we see them delivered differently or tweaked to really capture that senior audience?
Well, it's a great question. I have to say that I like the friend, and my friend and colleague Charlotte Ye came up with this term "design for all," and I really like that. It doesn't have to be designed. There's so many things that are intentionally designed for older people turn off older people because they feel like they're being pandered to, and so there's a mix between, I don't know, something that would be intuitive to a digital native, say a Gen Z, I don't know, maybe TikTok as an example, and wouldn't to a person in my age group or older. But that doesn't mean we design it and pander to them. We design things so they're usable for everyone. A great example of that is the interface on the iPhone and the iPad. You don't need a user manual to teach you how to use it. A 3-year-old can do it, or a 80-year-old can do it. And that kind of design is really helpful in getting folks engaged. I think that's the main thing: is good design and good engagement.
And so when you talk about engagement, though, a lot of seniors, for instance, are turned off by some technology, maybe because it's not familiar. So I guess, for some of the older patients, how do we really get some of these devices or remote home monitoring into people's homes?
Well, it always helps when it solves a problem that they care about. One very sort of good example of, I think, what you're talking about are these tools that are developed for adult children to keep track of their moms and dads that are senior citizens. And they sell pretty well to the adult children, and the seniors tend not to like them because they feel spied upon. So on the other hand, I love seeing the adoption of a video call by seniors, because they can have a face-to-face, as we're doing right now, call with their loved one. And they just lap that up because it's something that solves a problem for them. So you transfer that to health, and all of a sudden saying, I can Skype with my doctor. That makes total sense. Let's go for it. So I think a lot of it is about solving problems that they care about. And of course, there is a rub there, because sometimes we want to solve something that they're in denial of or what have you. And then that's when, again, the real motivational tools come in. It often requires someone to really understand what they're afraid of or what they care about to get behind that and get them more motivated to use a certain tool. It's often not the technology. It's often the way we foist it upon them.
You recently tweeted that the choices we make in the next few months will determine the landscape for telehealth in the U.S. for at least a decade. We just saw a decade's worth of jumps in innovation when it comes to use of telehealth during the pandemic. What are you expecting we need for telehealth moving forward to survive and continue on as a central piece of our healthcare delivery, particularly for seniors?
Well, for seniors, Medicare is pivotal. And right now, Medicare is allowing for any senior citizen to get telehealth wherever they are in their home and wherever, as long as their doctor is licensed in their state. It wasn't always that way. It used to be that they had to be in a certain geographically narrowly restricted living area and had to travel to a clinic, and the doctor on the other end had to be in a clinic as well. That's a law. It's been forgiven now for the pandemic, but we want to get it changed. I think that's a big one. Medicare has been very proactive about wanting to reimburse for more digital health services, telehealth being one of them. So I think they're all in, but they're right now bound by the law unless we change that. So that's probably my biggest. There are others, but and I'll come back to usability again. Let's make sure it's easy for people to use.
Well, Well, that's terrific. Thank you so much for joining us today, Dr. Kvedar.
My pleasure. Great to be with you.
Thank you all for joining us this afternoon for another virtual conversation that has made everyone smarter, faster. For more information on healthcare news of the day, sign up for the Axios Vitals newsletter at axios.com/newsletters or check out the Axios app. Thank you all for joining, and we'll see you on axios.com.